What if your body already had everything it needed to heal itself? What if instead of masking pain or covering it up with medications or rushing into surgery, there was actually a way to repair that damage on your own? To rebuild what was lost, regenerate what was torn down, and restore function from the inside out. This isn't a fantasy, this is the science behind regenerative medicine or orthobiologic therapy. And today, I'm going to break down exactly what it is, how it works, and why more and more people are choosing it as their path back to living the life they want. So let's start with the basics. Your body is remarkably good at healing itself. And you already know this intuitively. You cut your finger and it heals, you break a bone and it knits itself back together. You get sick and your immune system mounts a beautiful response and clears that infection out. This happens because your body has an entire biological repair system built right into it. Specialized cells, growth factors, proteins, and signaling molecules that are all constantly working to maintain, repair, and regenerate your tissues. The problem is that the system has its limits. Certain tissues in your body, particularly cartilage, tendons, and ligaments, have a very, very poor blood supply. And because healing requires blood flow, those tissues heal slowly, incompletely, and sometimes not even at all on their own. So you end up with a knee that never quite recovered from that old injury, or a shoulder that's been aching for years and years, or even a joint that's been grinding down slowly and steadily, and every year it gets a little worse. Traditional medicine has typically offered two responses: manage the symptoms with medication and injections, and then eventually replace the joint with surgery. Both of those approaches have their place, but neither one of them actually repairs the underlying damage. Regenerative medicine or orthobiologic therapy takes a fundamentally different approach. Instead of managing the problem from the outside, it works to activate and amplify your body's own repair system from the inside. So what exactly are orthobiologics, or what is regenerative medicine? Well, like I mentioned, it is using your body's own natural repair mechanisms. It's using biologic materials from your own blood or your own tissue, or sometimes carefully sourced cellular products to stimulate healing in the musculoskeletal system. The most well-known examples include platelet-rich plasma, commonly known as PRP, and stem cell therapy, also called regenerative medicine or orthobiologic therapy or cellular therapy. So let's look at both of these things in more detail. PRP therapy starts with something simple. It's just a sample of your own blood. That blood is then placed in a centrifuge, which is a machine that spins it at a high speed to separate its components. And it's centrifuged twice. What we're after is a platelet-rich plasma, or a concentrated portion of your blood that's packed with platelets and growth factors. Now, platelets are best known for their role in clotting when you bleed, but they do so much more than that. Platelets are essentially first responders. When they arrive at an injury site, they release a cascade of growth factors and chemical signals that tell your body to begin to repair damaged tissue, to reduce inflammation, and generate new blood vessels to support the healing process. So by concentrating those platelets and injecting them directly into a damaged area, like a worn down knee joint or a torn tendon or a meniscus or a rotator cuff, we're essentially delivering a concentrated healing signal right to where your body needs it the most. Think of it like turning up the volume on your body's own repair broadcast. PRP has been studied extensively for conditions including osteoarthritis, rotator cuff injuries, tennis elbow, plantar fasciitis, you name it. And for many patients, it has provided significant improvement in pain and function without surgery and without the side effects associated with steroid injections, which can actually accelerate tissue breakdown over time. Now, stem cell therapy takes regenerative medicine even one step further than PRP. Stem cells are often called the body's master builders, and that's because they're undifferentiated, meaning they have the remarkable ability to develop into many different types of cells and cell lines depending on where they are placed and what signals they receive from the body. When stem cells are introduced into a damaged joint or tissue, they can turn into the specific cell type needed to repair that specific tissue, whether it's cartilage or bone or tendon or more. They also release very powerful anti-inflammatory and regenerative signals that create an environment more conducive to healing throughout the surrounding area. The sources of these regenerative cells vary. In some protocols, cells are harvested from your own bone marrow or your own fat tissue, and other very carefully processed cells come from ethically sourced biologic materials. What makes stem cell therapy particularly exciting is its potential to do something that was previously considered impossible: actually regenerate cartilage and other tissues that the body can't rebuild on its own. We're not just talking about pain management, but we're talking about structural repair and the prevention of surgery. Here's something that most physicians and patients don't know when they walk into an orthobiologic procedure. The outcome of your treatment significantly depends on what you do before and after the procedure, and not just on the procedure itself. The procedure itself is extremely important, and so having a well-trained physician do the procedure is very important. But think of it this way. If you plant a seed in a dry, depleted soil, it will struggle to grow. But if you plant that same seed in enriched, well-nourished soil, it thrives. And your body is that soil. The regenerative cells and growth factors delivered during orthobiologic therapy need the right biological environment to do their best work. This means that your cells need to be well nourished, your inflammation needs to be managed, and your body needs the right raw materials to actually carry out that repair process. This is why cellular preparation matters so much. Specific nutrients play a direct role in supporting stem cell activity, reducing oxidative stress that can interfere with healing, protecting new tissues as it forms, and enhancing the overall regenerative environment in your body. Compounds like collagen, creatine, quercetin, NAC, and many others have been studied for their direct effects on cellular health, tissue regeneration, and the reduction of inflammation that so often derails the healing process. When you arrive at your procedure with a body that is genuinely prepared at a deep cellular level, and when you continue that support during the critical recovery period afterwards, you give your regenerative therapy the best possible chance of delivering the results you came for. Orthobiologic therapy isn't just for the elite athletes or the extreme cases waiting for joint replacement surgery. It's for the person who has been told their only option is to manage the pain and wait for it to get bad enough to justify surgery. It's for the active adult who refuses to accept that slowing down is inevitable. It's for anyone who's been living with subacute pain, chronic pain, tendon issues, or degenerative conditions and wants a path forward that actually addresses the root of the problem. It's for people who want to stay in the game, whether the game is hiking with their family, or picking up their grandchildren, or competing in a sport that they love, or simply moving through daily life without pain. And it's for people who understand that healing is not passive, that getting the most out of a regenerative medicine procedure means showing up prepared, supporting the process during recovery, and giving the body what it needs to do its most powerful work. Your body wants to heal. It has always wanted to heal. It was built for it. Orthobiologic therapy works with that natural drive rather than working around it. It amplifies your body's own repair signals, it delivers them where they're needed most, and it gives damaged tissues a genuine opportunity to rebuild. But the most successful outcomes happen when the whole system is supported, when the body is prepared before the procedure and nourished throughout recovery, when the cellular environment is optimized so every regenerative signal has the best possible chance of receiving and being acted on. And that's the philosophy behind everything we do with the Ignite supplement packs at Quinntessential Journey. Evidence-based, patient-centered, focused on genuine lasting outcomes rather than temporary fixes. You don't have to accept pain as permanent. You don't have to wait till surgery is the only option left. The path to healing may already exist inside you. Sometimes it just needs the right support to find its way.